Every child gets sick from time to time. A cough, a fever, diarrhea, or even a rash may seem like ordinary occurrences, but sometimes these symptoms can become serious if not recognized or treated early. Now, many of these illnesses are preventable through vaccinations, good hygiene, proper nutrition, and timely medical care. Yet misinformation, delayed treatment, and poor health-seeking behavior continue to place many children at risk. Now, tonight on Tupopyeni, we unpack the most common childhood illnesses affecting children in Namibia, and we establish how parents can identify danger signs and find out what every caregiver should know to keep children healthy and safe. I'm your host, Josie Pandro. Welcome to Tupopyeni, and we'll be right back after this very short break.
Every parent has faced a child with a fever, a cough, or a runny nose. But how do we know when it's something minor and when it's time to seek medical attention?
Welcome back to Tupopyeni. As indicated, an opportunity for us to discuss one or the other issue that affects us on a daily basis. Now, every parent wants to make the right decisions when the child falls ill, and tonight our panel of experts helps us to understand what is required of parents and caregivers to ensure that the kids are going to be all right. Now, joining me on our panel this evening, we've got General Practitioner Dr. Nelson Makemba. Welcome back, Dr. Makemba, and thank you for being here.
Thank you for having me on the program.
Also joining us, Pharmacist Senia Pius. Welcome to Tupopyeni, Senia.
Thank you, welcome.
And last but not least, a resident favorite, Dr. Daniel Japao, pediatrician and psychologist. Welcome back, doctor.
Thank you for having me, Josie.
Let's start at the beginning. I think I'm very excited that we're having this conversation because I have a 3-year-old who's in daycare. And every week there's something happening. And I think I'm going to start with you, Dr. Makemba. We notice that the most common illnesses that most parents know about when it comes to children are your flus, your diarrhea, but there are a lot of other illnesses that can send parents into panic mode just because we are not aware. So let's first compartmentalize. On the one end, what are the most common illnesses that children at one point or the other will face, especially if we divide it between toddler years and, of course, pre-teens, for instance? And then what are the ones that are not so common that are probably serious and deserve immediate attention?
Yeah, thank you for the question, Josie. What we tend to see happening commonly in the pediatric population, especially this time of the year when it's cold like this, like you've highlighted earlier, are your respiratory illnesses. Mm-hmm. Now, those will include now common cold, throat infection, ear infection, mm-hmm. And even sinuses sometimes. You know, we tend to see this quite happening commonly. They tend to then get rebound of fevers, for instance, and if the fever persists, they might even get into a febrile convulsion where they might have a fit or a seizure because of the fever that is present. Yeah. Diarrhea and vomiting. The problem with that is that if it persists, it then leads to dehydration. Mm-hmm. That can also be a problem, and it might be life-threatening. Especially now with the daycare, when they're playing one with another, they sort of always in close contact, the infection tend to spread somewhat a bit faster among children. So you're looking at also common skin conditions, that are infectious in nature, that just, molluscum, impetigo, ringworms. These are kind of things that, children are sort of prone to. Mm-hmm. And obviously one of the nightmares that you don't want happening to a children if a child picks up a meningitis, and then they get this severe headache with neck stiffness, and that also can be common quite in the pediatric population as well. And also looking at the demographics in terms of socioeconomic status, then obviously you tend to see malnutrition as well, depending on the demographics where the child is coming from. Yeah. So that's also something that we tend to see. They also get prone to then getting infections such as pneumonia, especially if the immune system is not strong enough. And that also is a bit of a tough one for the children. If not promptly managed, it might lead into all kinds of complications.
And I think I have a few follow-up questions on that. But first, let's go to Senia. Senia, one of the things that most parents struggle with is knowing when to go to a pharmacy and when to see a doctor. And when we look at the complexities of how expensive healthcare is, private, of course, more parents think, we save a little bit more money if I just get something over the counter as opposed to going to actually see a doctor for proper diagnosis. As a pharmacist, when should parents be comfortable enough to get something over the counter that they know, a pharmacist can definitely assist not only in diagnosing but also prescription, and when is it absolutely necessary to go to a doctor?
Thank you very much for the question. I believe that a pharmacist is one of the easily accessible healthcare practitioners in terms of when it comes to providing healthcare.
Yeah.
Because we do not only just issue out medicine. Sometimes we just give supportive care. We give them advice. But as pharmacists, we also treat mild childhood illnesses. This include now, as Doctor mentioned, upper respiratory infections, such as your throat infections, you have your colds, you have your cough, and mild skin conditions that do not include fever. We can treat any rash, like a nappy rash in children. But in cases when we pick up certain symptoms that are not aligning to those that are usually presenting when it comes to over-the-counter, we recommend these patients to go see a doctor.
Yeah.
In a case where a child is presenting with shortness of breath, for example, a fever that is accompanied with neck stiffness, that is alarming. You have to advise the patient, or the mother rather, to say, you need to see a doctor, because not everything is entirely treatable over the counter, because what we do over the counter, we are just trying to manage the symptoms, but also keeping in mind that this might be a presentation of a disease. It might be a first stage of a disease. So our focus is not just to say we need to treat this. No, we need to be on the lookout and be mindful. What are we treating? How long has the symptoms been presenting? Is it just, did it just start yesterday?
Yeah.
Has it been going on for a long time? How long is the fever going on? So we can determine the extent to which the infection or the illness is going, then we can recommend them to see a doctor. And in case, for example, doctor mentioned earlier that it is sometimes diarrhea or vomiting, that can be very serious. Because it poses a high risk of dehydration, depending on how long this child has been vomiting or having diarrhea. So in cases like that, sometimes you don't want to stop the diarrhea, you want to see what is causing the diarrhea, and then you also want to give rehydration so that this child can come back. Yes.
Wonderfully said. Dr. Japao, let's talk about attitudes. And we find that in a lot of households, our attitudes towards any kind of illness is directly proportionate to, one, what we think gender roles are, but two, also, what did Kuku from 1980 say? When your nose is runny, this is something that you can do as opposed to seeing a doctor, right? And how that can sometimes be dangerous when a child is confronted with an illness or a disease of sorts.
Yeah, unfortunately, there's no way we can avoid that. Because tradition and culture is something passed on from generation to generation. So whether it's medical or whether it's relationship-wise or whether it's something socially, we always have an alternative to it. So now the problem comes now where parents probably want maybe to refer the child to medical services, and then maybe the grandparents will then say, no, this is what we used to do in the past.
Yeah.
Now that conflict and that contradiction, number one, it delays treatment for the child.
Yes.
Secondly, it now creates a psychological vacuum now between their parents who the grandparents who are concerned about the child, and then they want to go in a natural or herbal way or traditional or whatever with the way they think, and then the parents thinking to take to Western
medication.
We now say it's medical, but if we have to go back, we basically align it to Western. So the problem that comes there, it now creates other problems that were not there, whereby some conflicts may arise, and in the long run, in some cases as well, some of these our alternative medication, they are a little bit traumatic to kids. Like one that
the one that they put up the bum. I know exactly what you're talking about. I remember. Shout out to my grandmother, but no.
Yeah. So, but if we have to look at it, it's basically there are two. You will also find one in the pharmacy.
Yeah.
And like they mentioned, they are also over the counter. But then there are those that are now that you have to buy through a prescription. Now with ours, this one, it's not regulated, so it's the content in there, and then when they flush there, and sometimes you have to lie down on your stomach and you are held here, so it really becomes it's something that's traumatic and it's emotionally challenging. The challenge comes now in how to find a balance, because at the end of the day, medicine is proven to be effective when it's prescribed for a specific illness. When you're having an infection, obviously antibiotics. When you have fever or anything, you take an analgesic. And then when you have any other condition, if like gastrositis or something that with gastric, you take something that like Eno or over the which is cheap, or you can get a Buscopan. But the problem comes now where choosing, because in some cases it might work for a certain child and then it doesn't work for the other. Now, when they take the child now to the hospital or anywhere and things do not turn out the way it is, these ones then they have to again come and report back here, and these ones then will ask, okay, we advise you to do this because we know as elders, but then you did that. So it's really a trauma, it's a challenging thing, and it requires calm heads as well as maturity in handling that.
And also ultimately putting the child at the center of the decision. It's not about what the elders think or what the parents think, it's about what is good for the child. Dr. Makemba, I want to ask you, what are the symptoms that children display that a parent must never ignore? And the reason I'm asking this question is oftentimes you find that there will be a symptom or it persists for long, and then when we go to the hospital, we're going straight to ICU, and you think, but it was just a runny nose or it was just a fever, but this happens 4 times a year, for instance. So maybe just a bit of clarification for parents so that they know, look, there are certain things that you just cannot ignore.
Yeah, the children really, the window period in terms of, making a decision and from the time they are presenting can be very key in the outcome of the management. So if a child is having a fever that is persistent and maybe started to convulse, that's then a febrile convulsion.
Okay, we're using big words.
Convulsion is like seizures, fitting.
Okay.
Yeah, so that child probably need to be taken to the health facility as soon as possible. If a child develops diarrhea and vomiting and it's seemingly persistent and the child is becoming weak, that also might then mean that your child is becoming dehydrated. So that child probably needs to be seen by a doctor as soon as possible. A child that is having a cough that is severe and persistent with difficulty in breathing. And when the child is having difficulty in breathing, we often refer to that as respiratory distress. So when they are breathing, you can actually see they got what we call alar flaring. Their nostril is sort of going in and out. If you look on their rib cage, between their ribs is sort of going in and out as well, and underneath their rib here. And then you can actually literally see they are breathing fast. That's sort of, a sign of respiratory distress that probably might need to be taken to a facility somewhere as soon as possible. If a child is having decreased level of consciousness, extremely drowsy, very difficult to wake the child, that also is a danger sign. If your child's lips are becoming blue, the skin is becoming blue, that might mean that child is cyanotic and the oxygen level in the blood is somehow dropping. And if the child is complaining of pain and the pain is getting severe, or an unresponsive child, or a child that is having a fever and now apparently the child seems confused. All of these are sort of danger signs that you don't sit with a child like that at home and wait for them to blow.
Before you proceed, doctor, what does the word cyanotic mean? Because it's very important we use basic words.
Yeah, like I said, when the lips are blue and the skin is blue, that is cyanotic, meaning that the oxygen level in the blood is actually dropping. That you tend to see particularly with severe respiratory infections. So those are some of the danger signs that, you don't sit on them. And if you do sit on them, by the time you get to the health facility, at times it might be a bit too late. People might try everything they can, and if it's really way too late, you know, the worst case scenario, one might even end up losing a child. Yeah.
Wonderfully said. Senia, what should parents never give their children without consultation? You know, every household always has a medicine cabinet. And you know, us as mothers, we think we are the pharmacist and the doctor and the pediatrician wrapped in one. But the truth is we did not study these things, right? So and medication, these are chemicals. It is highly dangerous to administer medication to a child unsupervised. So what kind of medication should parents always be sure to get advice from a pharmacist before administering to a child?
That question brings me back to the concept that says children are not small adults. And we see this a lot happening in the society because parents tend to just give the children whatever medicine is there. So if they got maybe a certain medication and they took one tablet, they're gonna give the child half a tablet. And actually that poses a very high risk because a dose is based off the weight and the age of the child. And this should be professionally determined by a pharmacist, a doctor, or health practitioner. But one of the key or major medicine that I feel like should never be given to children without supervision is antibiotics. Number one, that is a very, very big concern because we have a belief in the society that everything needs antibiotics, but actually we are damaging our own bodies with those antibiotics. We are doing more harm than good when we give everything antibiotics because not everything needs antibiotics. Secondly, should never give expired medicine. It's very important to always clear the cabinet. And medicine, for example, herbal medicine or supplements that do not indicate that it's safe to use in children. You should never do that because that sometimes there are no clinical studies to give the safety of this drug in this little baby, and you give. And also it's very important to note that just because a medicine worked on child A does not mean it's going to work on child B.
Very true.
It is a big concern when parents do these decisions in a hope of, say, the child is going to get better. Sometimes prevention is better than cure. You might think you are actually treating your child, helping your child, but you are doing more harm. Yes, sometimes you are even going to an extent of masking symptoms. Sometimes a disease can present with symptoms and you are treating it. For example, fever. It's just a fever, you want to treat it. Yes, the fever will go away, but it's going to mask the underlying condition. Sometimes it's really good to prevent these things. Take the child to the doctor, see a healthcare professional, see a pharmacist. They're easily accessible in the community.
There are nurses at clinics also, absolutely. Now, the next part of our program that we're going to go to is advice, where each one of the doctors are going to give you proper medically sound advice, not the Google things that we are used to. So I'm going to go to a break and give you guys an opportunity to grab yourself a notepad and a pen, and we are going to be right back on the other side of this, where we start off with Dr. Japao, and the conversation continues by discussing vaccines, how to prevent or to mitigate children getting easily sick in daycare, and most importantly, how to treat or administer issues at home. You're watching Tupopyeni, the show that says, let's talk, and imparts knowledge on a weekly basis, and we will be right back.
Every parent has faced a child with a fever, a cough, or a runny nose. But how do we know when it's something minor and when it's time to seek medical attention? Every parent has faced a child with a fever, a cough, or a runny nose. But how do we know when it's something minor and when it's time to seek medical attention.
Welcome back to Tupopyeni, and tonight we are discussing early childhood illnesses and how to best guard the child against misinformation, but also misdiagnosis. Now in studio tonight, I've got Dr. Makemba, I've got Senia, as well as Dr. Japao, and we are unpacking this rather complex topic of discussion. Now remember, this is a perfect opportunity for you to call in and ask any of the questions, burning questions that you might have with regards to symptoms, with regards to diagnosis, with regards to administration of medication. The line in studio is simple: 061 if you're outside of Windhoek, 291-3417. That's 061 if you're outside of Windhoek, 291-3417. Let's start off with Dr. Daniel. Vaccines. Are they necessary? Are they not? How do they protect children? One. That's one half of the question. But also two, what are the best ways to help sort of armor? You cannot completely turn the child into an Avenger and they will never get sick. Yeah, it's not Marvel. But there are certain things that parents can do and practice on a regular basis that can sort of make it a bit more harder for children to get sick, especially in school environments and daycares where they're all up in each other's space. And like Dr. Makemba said, it's so easy for diseases and viruses to spread.
Yeah, with vaccines, I think the answer is already clear on itself. The studies are there and the evidence is there. Polio is an example. So polio was eradicated and it was fought through vaccines. We have another one, which is HPV, the vaccine that young girls get before the age of 14, if I'm not mistaken, the one which prevents them from getting HPV.
Yeah.
So which means vaccines are effective provided the parents follow the instructions as well as the health passport. Now, health passports come in two. You find the pink one, which is for boys. And then you find for girls, and then you find the blue one, which is for boys. And in those, the vaccine schedule, you'll find that there are some that are specific that girls get and that boys do not get. The reason is because now it's to prevent and to arm them, like you said, with the immunities to fight against that.
Yeah.
The problem comes now with administering those vaccines, because some of them, especially the early ones, when a baby is still when the baby is a newborn, they normally get on the thighs too, and then they get on the arms. So as they at that stage, they are not really. You would not see that they are in pain, but as a parent you can see. But the older they get, they become aware. Now, when they become aware of now the vaccine,
they hate going to the doctor.
The only thing in their mind is now just, okay, when I'm going, when they just hear doctor, in their mind is just it's a vaccine. So they now, as because they started off with the vaccination, with immunization. Now every time they go to the doctor, it's to them is now just vaccination. So there's actually something parents can do. I think if we look at in Namibia, most of our parents, most of these nowadays parents, we are having this Gen Z, most of them, and most of these parents have phones. So on these phones, I've noticed there was a time when I saw a friend of mine's daughter on Facebook, on WhatsApp, not WhatsApp, YouTube, and I explained to them that no, there is another YouTube for kids. It's called Kids Tube.
Yeah.
So on that Kids Tube, there are those shows that they normally watch. One of them is this popular one they watch, Doc Meets Stuffing or something like that. So kids are visual learners. So if you expose them to things like that, that's now rewiring their cognitive dissonance, meaning you are now readjusting their attitude so that they see it's really, because the way these cartoons portray this, it's free. I mean, especially when you have Wi-Fi, you just give it to the kids, because most of the time we give our kids phones, they are just playing Candy Crush, doing unproductive things. But there are shows that are tailor-made for that. There are also other shows that also teach kids about their health and how to say stranger danger, but they are always there. The only thing which we need to do now as parents is now to make sure that we expose them to this. Secondly, you also have to, as a parent, you can also come up. This is what actually I don't know whether because this is when I was in the 80s. We are from the 80s. So my dad and when I'm sick, I'm someone who really I really would not lie. I'm not someone who likes to eat. So now when I'm sick, they would promise me and say, no, if you go and then you behave yourself, you'll get chips. And that was my favorite. So
Also, they bribed you.
yeah, it's basically a bribe. As a parent, you have to, there are some techniques that you have to adapt. Just learn, study your child. If your child likes a certain thing, and then you say, okay, if you behave yourself this week, you have extra time with the PS. If you behave yourself this week, you have extra. So just that to say, okay, this is coming, so that they can just prepare themselves to say, okay, I know, and then they will ask themselves, but why is dad going extra mile to make it look fun, or mom, or why are they doing that? Then the child automatically, even though they spend, they'll build up that resilience and that strength. When they come to the time of immunization, they already know what to expect, because you have already readjusted their attitude and you have rewired them to vaccinations.
Yeah.
So it is very, very much important, and it's very vital, and there is no way we can go around that. The question comes in now to agree to disagree, because we do now find conspiracy theories, and then we find, but when it comes to facts, the evidence is clear.
And the data is there to support it. Dr. Makemba, then I think I'll ask you the follow-up question I wanted Dr. Daniel to answer. How to armor a child's immune system to make it less easier for them to be susceptible to viruses. Because, you know, I think a lot of parents underestimate the importance of things like drinking enough water, getting sunlight, good hygiene. And oftentimes we send our children into these environments at schools and so forth, where the entire faces and they're spreading, they are in each other's faces and in each other's spaces. And it's so easy for them to contract something. So what are the best ways, what advice do you have for parents on how to arm immune systems, especially of toddlers?
Right. Let me address the question first by highlighting one important aspect of the immune system.
Yeah.
We have two types of immune system. You got what we call an innate immune system. That's what you're born with. When mommy gives birth to you, you have this already. The skin, for instance, is a barrier protection. That's also part of your immune system. The tears in your eyes, actually, you know, they protect your eye. The saliva, they have the enzymes. When you eat it, they digest whatever is in there. The acid that you produce in your stomach, that too protects you. And then obviously the white cell count, macrophages, which is, you know, natural killer cells, and the neutrophils, which are pus-forming cells. Now that you're born with. Then we have an adaptive or an acquired immune system. This is what you develop as you evolve and as you grow.
Yeah.
This comes through vaccines and just naturally being exposed to microorganisms in society, be it viruses or bacteria.
Yeah.
So the body then becomes smart that once you pick up an infection, for instance, it develops antibodies. And then if you beat the infection, if it comes around next time, your body has memory cells and is able to pick it up and fight it off, you know, effectively. Now the importance then of vaccines comes such that the vaccine basically just means we are now exposing you to an organism in a controlled manner, in a manner that is not making you ill, so that you develop antibodies. So that when you are out there in the community and you are now exposed to the actual bug, your body is able to recognize it and then fight it off. And that's what, you know, he was explaining earlier to say, for instance, you know, polio that used to, you know, sort of wreak havoc in society. It has actually been dealt with, you know, because of, you know, these vaccines.
The vaccinations,
so the idea then is that parents should adhere to that schedule that is in that, you know, a card that they get when they leave the hospital, to take their children, you know, to the clinics and to the health facilities where the vaccines are administered on time, endeavorly based at what age your child is and what need to be given.
For interest's sake, just while we are there, what happens is, because, you know, sometimes life gets busy and as a parent you might forget. What happens if we miss the date of a specific vaccine?
No, I mean, we do catch up. You know, if you miss one or two, you know, you can still always go back to the clinic and then explain to the healthcare provider and say, a month ago my child was supposed to come in, I just realized we missed the date. One can still go around, you can get given what is, you know, missed, and then, you know, your next one is readjusted then based on, you know, at the time that you have gotten your vaccine. So there's always a way around, you know, getting, you know, what is missed as well. So you are just not left now to say you missed this one, it's gone.
It's gone. Okay. And daily supplements that help with immune system protection?
Immune system protection, you know, a child that is well hydrated, a child who is eating a nutritious meal that is well balanced, a child that is allowed to play, because then that is a form of exercise to them. That child will do well in terms of boosting their immune system, and also making sure that your child get enough rest. You know, don't allow your child to be up until midnight and stuff.
Yeah.
So let them get that, you know, good 8 hours of sleep. That also is good, you know, for them, you know, to have actually their immune system, you know, sort of, you know, stronger. And if you do these things, you're likely going to have a child that is going to grow up very healthy and robust. And like you've highlighted to earlier, it does not necessarily mean that we are going to rid your child of picking up any infection throughout their childhood. They will get a common cold here, they will get, you know, a stuffy nose once in a while. But if the immune system is strong enough, you know, the symptoms might not even last that long.
Yeah.
By far, most of these common colds are self-limiting. They tend to clear within 7 to 10 days.
Yeah.
But a child whose immune system is otherwise robust, it might even clear earlier than that.
I always wondered why my child's flus only lasts 3 days.
Yeah.
I'm going to remind her she's very robust. And Dr. Makemba said so. Senia, what must be in my medicine cabinet at home? You know, it's sometimes we are caught off guard. Sometimes, like you said, is the issue of, oh, I have a medication that helps with my flu, and thinking that maybe that can assist with the child also. So what should be in my medicine cabinet? What should be in my safety kits for kids that can assist in sort of immediate assistance once something minor comes up?
Okay, it's very important to ensure that you have always a first aid kit in your house, especially for mothers.
Yeah.
I think we should be able to cultivate that spirit of having a first aid kit in your house. You can have it in your car, easily accessible, because your child is also easily accessible. So it should be where your child is. So in this first aid kit, it's good to have something for fever, paracetamol. You need something for diarrhea. You need a ORS, rehydration salt, something to stop vomiting, and then you also need something for stomach cramps. You also need, especially for, this is not really applicable to children, but I always recommend my patients to always have activated charcoal, because sometimes someone can ingest poison, and activated charcoal is actually good when it comes to absorbing poison. So that period of transporting the patient to the hospital, and then they took in the activated charcoal tablets, it can really do so much while the healthcare professionals engage when the patient gets to the hospital. So yes, it is very important to have that. You need to have, for bruises and cuts, you need to have wound dressing, you need to have wound cleaning and normal saline. It's actually very important to ensure that each household has a first aid kit.
Wonderfully said. Dr. Japao, I want to ask about immune boosters and gummies and all of these things, because you see, sometimes you find parents swear by them, and you have a child ingesting these things every single day. What is your advice from a pediatric perspective on how to give, especially the young ones, the 1, 2, 3-year-olds? Is it like normal to give them everyday immune booster supplements, or what is the best prescribed way of doing so?
I will go back to what Doc said. Immune boosters, it's just an addition to, at least let's say, strengthening to what's already there. It's not really necessary. The child is already on vaccines. The child is already fine, and the child already has an immune system. Now, sometimes it's like what we tend to do is you are creating a problem where there is none. So the most important thing, just like he said, it's the same. What a child basically needs. A child needs proper hygiene. A child needs proper nutrition. A child needs proper sleep. And then a child needs proper mobility. Mobility meaning moving around. The child also needs sunlight, because that's one thing that people mostly neglect. They'll say, okay, the child has to play inside the house because they are naughty.
You're not allowed to go out.
Okay, they'll be playing in the house, but in the house there's no sunlight. So they sometimes have to go outside. It doesn't mean now they have to play outside when it's on a hot summer's day, but they need the sun so that they can also absorb some of the nutrients that comes from the sun. But immune boosters are wrong. We are not saying they are wrong, but now what happens is this. When you make a child used to something, when they grow up, because mind you, habits become a habit. It's something that you just it's something you pick up or someone teaches you about. Now this child has been on immune boosters. They come to their adolescent, they come to 18. What will happen to them now is like their immune boosters will be now put one side, and then they will replace it now with something else. It can now be probably maybe to say, no, for me to be strong. That's where now you will find many people. We are not, I think maybe just I need to be clear on this. We are not against herbal supplements. We are not against all this alternative medication. But the problem comes now if these things have not been approved by the FDA. Now, this child has been on immune boosters their whole life. When they grow up, they're like, I need something extra. Now they go buy all these other products, add them to them, and then they will then start to neglect proper medication. At the end of the day, we are now having so many people sitting with diseases caused by antimicrobial, meaning they were given antibiotics to drink, but then they just drank a certain time, and then someone came along and said, no, these are immune boosters that you need to take, and these immune boosters, they will help you. So then they leave the traditional ones. We have people on ARVs, and I have seen it. I counsel people sometimes when you speak to them, because in most cases when we look at people, we just assume, but first hear from them. So when these people come, they will tell you that, no, I used to drink this, and then I used to take supplements, so this is now also just helping me. So immune boosters are not a problem, but they should not become a habit. They should not become compulsory. It's good to give once in a while, but not to become, because like I said, something learned becomes natural, and then when it becomes natural, it then damages in the future. What happens to these kids again? They pick up these traits from young. They will again also impact it on their kids. So we need to have a balance there. We are not stopping the public, but we are telling them to take it in moderation and under the strict supervision of a licensed and certified general practitioner or pediatrician, especially for children.
And also to allow the body to do what it can also do. Sometimes we are so focused on over-medicating, we don't allow the body to do what it can do.
Definitely.
When is it not safe, Dr. Makemba, to send your child to school? This one is a very serious one, because every week, for instance, the past 4 weeks, my child has come home with something that was not hers to begin with, and it starts with a parent just saying, it's just a runny nose. They send the child to school, and now the whole class is sick. And this is also where we must advise parents to take a bit of responsibility in terms of safeguarding not only their children, but other people's children as well. So when is it safe to send the child to school? When there is a show of some kind of virus or symptoms, and when must a child be absolutely kept at home?
Like we have highlighted to earlier, the problem with daycare facilities, that the nature of children is that when they are interacting, they are in close proximity to one another. So if your child is having a persistent cough and the child is feverish, if you send that child to daycare, they will be coughing in the presence of the others. And then obviously when they cough, these bugs are aerosols, so they are released into the atmosphere. So the others in close proximity, they are breathing in these bugs. They are likely to pick up that one. And also diarrhea, for instance. Diarrhea is fecal-oral sometimes. If your child has diarrhea, for instance, and obviously in as much as Junior is well potty trained, if Junior's tummy is not so well and he runs to the bathroom all the time and maybe doesn't clean his hands properly, and then he comes now and he's sharing his lunch boxes with a friend, the bug can actually be spread that way. Pink eye, for instance, and conjunctivitis, because children tend to scratch their eyes, and then they are, pulling each other's hand. I scratch my eye and I got an eye infection. You touch me and then you go scratch your eye. So that's how these bugs tend to actually spread. So if your child is having a red draining eye, if your child is having a fever and a persistent cough, if your child is having vomiting and diarrhea, and these are contagious skin lesions where the child is having impetigo, for instance, there's pussy, lesions on the skin, and it's really wet. If the fluid on that lesion sort of end up on the other child's skin, that infection can actually spread like that. So those are some of the areas that parents need to be mindful of. And just inform the daycare teacher to say, my child isn't feeling very well, and I'm trying to sort of look out for other children as well. Probably, maybe I'm going to keep him home for the next 2 days. And in the 2 days, if the situation is actually not improving, I might even take him to the doctor.
Yeah.
So in that way, you're actually going to protect, the community at large. Because also, mind you, when Junior picks up an infection at school, you picks him up, he passes it on to you as well. So even us parents sometimes become recipient of whatever our children bring home from the daycare.
That is very, very true. Thank you very much, Dr. Makemba. Very briefly, before we do conclude our show, the storing of medication at home. What is the correct way to store the medication at home? And also, on behalf of Namibia, I would just like to pick a bone with pharmacists everywhere. You guys always put the sticker on the side where the English is, and you leave us with the Africans, and we don't understand it. Yeah, or the French, right? So just what is the proper way of storing medication, and how long may someone keep medication, for instance? Do you know utensils that accompany medication? What's the best way to make sure that they are clean, so that you also you are not the enemy against your child's progress in health?
Okay, just a disclaimer. So we do not, we just do it unexpectedly. When I grab the box,
Every time.
When I just grab the box and the sticker, it just happens.
Yeah.
Unfortunately. And then later when you say, no, put it on the African side, it's already on the English side. So it just happens. So yes, when it comes to storing medication, it's very important to ensure that you store the medication in a closed cabinet, preferably, that is out of reach of children.
Okay.
And then ensure that it's away from light exposure, heat, and moist, because you want to maintain the integrity of the medicine. Unless opened.
And the fridge? Yeah, because that's a big one. You will find someone who do 2 entire rows is just for medication. Then you read the bottle and it says store in a cool, dry place. And now we don't know if cool, dry is also the fridge.
So usually it's before you open the box. You need to store it in a cool, dry place, right?
Okay.
But after you open it, you can store it in the fridge, just not in the freezer.
Okay.
Yes. And some medicine, like prescription medicine, like antibiotics, some of them come mixed already. So you need to carefully ask from your pharmacist that is dispensing, of course, to say, where should I store them? If they don't put on the sticker to say store in the fridge or keep in a cool, dry area. And then secondly, you need to ensure that your medication stays in the containers or the boxes, the original boxes. Do not remove them and just have medication lying around without the original, because you might actually mix them.
Yes.
Yes. And always discard the expired medicine. So you don't discard them yourself, you need to take them safely to the pharmacy. Yes, you don't have to
we just throw in the dustbin.
You need to make sure that you take it and hand it over to the pharmacy. So what patients usually do, they maybe do like a 2-monthly cleanup, and then they always bring the expired for proper disposal at the pharmacy. And then you also need to ensure that if it's, for example, the child was taking an antibiotic and it was for 5 days and there was still extra left, you need to also take that to the pharmacy for it to be discarded.
So you don't keep it until they show symptoms next time and you want to use it.
No.
We are saving money. The economy is tough. No, but I hear you. And I'm so glad that you said it also, because these are some things that parents innocently do, thinking that, we are trying to be economical, but it can actually be very dangerous.
Yes.
Thank you, Senia. Dr. Daniel, I know it's going to be difficult, but I only have 30 seconds for you. Any last-minute advice just to parents who like to panic? And there are a lot of us. I am personally the class captain of the panicking parent group, right? And then it becomes, because you love your child. No one wants to see their child sick and feeling weak and all of that. So we go into a frenzy, and sometimes we deplete the medical aid without having to. So 30 seconds, any bit of advice on just attitude towards our children being sick?
There is no advice. I'm also a parent myself. I panic when my child is sick.
Okay, good.
So, but there is only one thing that parents can do. First and foremost is to first get the facts. Find out, is it an infection, or is it just a flu, or is it just a cough? So how do you get that? Those doc mentioned that when the child is sick, let them rest a bit, a day or two. But if you see certain symptoms that are like breathing difficulties, that's where you can panic. But if it's a headache, accompanied, but if it's a headache on its own, it might just be due to the environment. But if it's accompanied by something else like diarrhea, then you can now see that this is, because every time in a headache, mind you, when there is a headache, this is also one thing that, especially with pediatrics, a headache always there's something underlying. Senia mentioned it. So the panic, do not panic. Because when you panic, then you make illogical decisions.
Yeah.
And also parents should also know that the child is sick. So he or she is already panicking and they are looking up to you. So in front of them, do not show that weakness, but show them that you care. And then you take them for care. Once you now find a diagnosis, because sometimes symptoms may present like a serious illness while it's just a common cold. Because many conditions present the same symptoms, but it might be a condition that just presents conditions that are similar to a serious condition. So parents should not panic that much. They should
and diagnose themselves.
And then diagnose. And the last one, which I plead, ChatGPT, Google are not doctors. ChatGPT and Google is the opinions of professionals, doctors, lawyers, as well as self-proclaimed gurus. So let's stay away from there. Take our kids to professionals.
Thank you so much, Doctor. And you've heard it here. We finally got advice from trained professionals. So we have heard tonight that childhood illnesses are common, but many can be prevented or treated successfully when parents act early. Now, knowing warning signs, keeping up with vaccinations, practicing good hygiene, and seeking medical attention in time can make all of the difference. Our great thank you to our guests for sharing their expertise and to our viewers for joining in on the conversation. Now remember, if your child is unwell, don't rely on guesswork. Consult your nearest healthcare facility. Please take note that tonight's program will repeat at midnight on NBC One, but you can also catch the repeats. That's on Wednesday at 9 a.m. on NBC One and 9 a.m. and 9 p.m. on NBC Two. And on Saturday, we do repeat at 7 a.m. and 2 p.m. on NBC Two. Don't forget that we also have a radio edition airing every Wednesday at 8 p.m. on National FM 92.6. From me, Josie Ngipandwa, and the entire Tupopyeni team, thank you for watching. And until next time, stay healthy and good night.